So VivaLNK is a provider of IoT-enabled medical wearable sensors. So we provide the wearable patch and also a data platform so that you can integrate human vitals and biometrics into applications for diagnostics and monitoring. Which button? Okay. Oh, this is not working. So some of the things that makes our wearable sensors unique is that it's very small. This is an example of one of them. It's an IoT-enabled device, so it streams live data off of the patient. And you can get a number of different human vitals and biometrics. We combine the best of consumer ease of use and wearability with medical grade, which is very important because if it's not comfortable, the patient's not going to use it, especially in a remote environment. So this is the patch. If you can't see it very well, that's a good sign because it's very small, and that's what we want. So I want to talk about an example of an application that was built on our sensor platform. So this is one of our partners, Alacrity Care, and they developed an application to basically monitor chemo treatments. So the idea is that, post-chemo treatments, when they get discharged, it's hard to monitor the progress and how things are going. So this solution involves basically the patient wearing these wearable sensors, and there's a mobile app that then collects the data and sends it over to a clinician's portal, and that's in a remote location. So it basically will notify them of health changes throughout this process. So they're doing a study right now with a cancer center, and this is an example of data from one of the patients. What's interesting here is that you see the red dot represents a hospitalization event after they were discharged. So in this case, 4 days after the therapy, the person developed a neutropenic infection and they got readmitted. So running the application and algorithm based on the vitals collected, they're able to detect that event 18 hours in advance by correlating what's going on with the patient and the trend. And so in this case, they use a combination of the temperature, heart rate, respiratory rate to correlate the event 18 hours in advance. So that's a significant amount of time to potentially intervene to keep the patient from developing more serious complications or coming back to the hospital. So that's an example of the type of applications that our sensors enable. So for us and our partners, it's all about data, algorithm, and applications. So if you're in the business of doing applications, algorithms, and you need data, this is the type of sensors you want to integrate with. So we're doing a number of different applications and research areas. And this is just a small example of some of the active research that's going on. So we're always looking for collaborators, customers, and partners to work with us. So if you see something here that's in the area that you're interested in, contact us. Okay. Well, thank you very much.
Time for questions. So sometimes, so they've mentioned something about chemo monitoring. Any oncologists in the room? Oh yeah, Shamli. Any question you'll?
I think I'll try to help. Thank you.
Okay. Yeah, we work with like hypertension applications. There's a study we're doing with a part of at Stanford that's doing stress and teenage depression. There's also another study with athlete performance. Yes?
Do you intend this to a consumer market, or this is a professional market?
This is for the medical market. The question is, do we sell to consumer or medical? We do have a consumer product, but what I'm talking about today here is medical devices.
Do you foresee this to be consumer down the road?
For now, we're going through the medical supply chain, but it's meant for a patient consumer to actually be able to apply and manage themselves, especially in a remote environment where there's no professionals around to help them out. And so we designed it to be very consumer friendly. Yes?
You had mentioned the word platform.
Yes.
So are you a platform where others can build their own sensors and their own software? Or
Yeah, so in addition to the hardware, there's actually an edge development kit for a home or remote environment. And you can integrate our sensors, of course, but also potentially other sensors. And there's also a cloud layer if you want to go straight to the cloud. Question?
Yeah. I have two aspects, but you can answer only one. On the security issues,
Mhm.
because that's going to be very important.
Yep.
And then how much is already integrated in EMR, EHR, PHR?
Okay, so security and privacy. So the data can be encrypted straight from the patch,
Yeah.
end to end, and there's no PII information on here, right? So it's all just anonymized data. Now, when our partners use this to integrate into an
Is it
application,
your own security or is you are using some other security company? OT?
well, we integrate security technology into our system.
Okay, so,
Right.
okay, we can talk about if we have companies in.
Okay.
Then on the EMR, EHR,
Okay, that would be done through our cloud, right? So our cloud we expose some APIs through that. You can integrate other systems in the back end. Yes.
Yeah, in the example, it detected an abnormality 18 hours in advance.
Yes.
Like, what does it do? Does it point it towards, say, like, something bad's going to happen?
Well, it flags it as a potential event.
Okay.
The question is, the 18-hour detection, what does it do with it? So it flags it as an event, as a potential event, basically, and sends it to a clinician. They look at it and evaluate it to see if it's truly an issue or not. Gives them an opportunity to reach out to the patient proactively, right? Instead of waiting for patients to report the symptoms, which sometimes could be too late.
So how have you validated your model? How accurate is it?
One second. Sorry.
How have you validated your model? How accurate is it?
Our model? Well, there's a couple of things. So we have to go through FDA clearance as one, but we also have different clinical trials and other trials going on at the same time. So
So
it's
it's not
two.
validated yet.
We have sensors that are already gone through the whole process, and we have others in development, so it just depends on which one.
But the accuracy is not validated. Is it FDA approved that, you know, this thing happens, then, you know, 80% chance of something bad happening? Have you done those
So we don't do the actual application and the diagnostics application. That's done through our partners. We provide the
What if somebody's
technology
exercising?
platform.
You know, you have a rapid heart rate. If somebody's exercising,
Yeah.
how does it know, like, you know, something bad is going to happen?
We don't predict that part, right? That's up to the application partners and their algorithms. We give them the basic human vitals and core biometric information, right, off of these patches. Yeah.
So what all vitals are you collecting?
Currently, we supply body temperature, auxiliary, and ECG rhythm, heart rate. We also have accelerometer for activity. And then we also have other, what we call non-medical stress indicators, like based off HRV and recovery levels. Once I think that person was ready. Go ahead.
So when you predict like the 18 hours before like an issue arises,
Yeah.
do you use like pre-existing data to predict that, or do you use like specific patient data? Like if they've had an attack before and that like the symptoms were like this before the attack, then do you use those same symptoms, or do you use like other patients' data and then just try and?
Well, that one is on that specific patient. But to be clear, the question was, how do we predict the data, the event, right? And is it based on other patients' data or that person's? So to be clear, we don't develop the algorithms to predict the patient event, okay? Right? We provide the core data for application developers and technology providers to do that kind of prediction. So I want to separate that out. And this specific example is based off of that patient's data. Now, you know, it's also like a learning system, right? So the more patterns, previous patterns it has across a large population, the more accurate you're going to have in terms of prediction. So it's going to ultimately be a combination of your data and also population data.
Okay, thank you. Actually, I will have to go to the next round, but Sam will be around to take more questions, okay? Okay, so thank you, Sam.
All right,
Okay,
thank you.
you.